Hey everyone, Dr. Ryan here from Fundamental Health. The other day I explained how hip tightness or hip instability can cause back pain, but today I wanted to highlight how the feet can actually contribute to your back pain. Here we go. So what I'll focus on today is not only the feet but the legs. There's a 90% chance that your legs, one leg compared to the other, is shorter than the other, which is going to throw things off. Also, if your feet are not supporting yourself, it's going to give you an unstable foundation. It's going to be like a chain reaction from the ground up. And then I'll briefly explain some exercises, some things you can do on your own to help your feet, to help give you a better, stronger foundation so that you're supported from the ground up and it's not contributing to the back pain. Let's first start with the leg length. If your doctor isn't properly assessing leg length, then a big piece of the puzzle is missing. I'm the only practitioner in the area who can accurately measure the length of the bones. Once we have that information, you will stand evenly with proper weight distribution. So what about the feet? If the feet collapse or don't support your skeletal frame, then the body will go into protection mode and lock down the joints in the foot and ankle. Ankle and foot instability will ultimately lead to rotation of your shin bone, causing a counter rotation of your thigh bone, leading to back strain. So finally, what's going on in the foot and how does foot instability affect you all the way up? So I showed this briefly in a picture that talks about how if you're having a short leg, which is very similar to having foot problems, it's going to affect you from the ground up. But here's what's going on. You have a foot, you have an ankle, okay? We're looking at it from the outside in, so we're looking at the outside of the foot right here. Oftentimes when you roll your ankle or just day-to-day activities, so repetitive stresses of walking, running, standing, they can cause things to shift and move out of place. This is very similar to what happens in the spine. This can happen in any single joint. Now when things start to shift and move out of place, your body's going to realize this and it's going to go, hey, this isn't stable, I want to protect it. So it's going to recruit muscles and it's going to change your physiology, your neurofeedback to try and stiffen up this area, trying to protect this area. So that's when the area becomes very locked down and is not moving as well as it should. So that's typically what's going on in the ankle in this scenario that I played out for you. It's not moving the way it should and you lack that mobility. What's going on? You got your heel bone here, which is your calcaneus. Then you have another bone that sits right on top of that heel bone called your talus. So you got your heel bone, okay? Then you got your talus right here that sits on top of that calcaneus. And then you have your shin bone, which comes down on top of that talus. Those are the three bones that make up the ankle. What can happen is that calcaneus rotates in or towards the middle of the foot, towards your big toe, okay? That causes the talus, the bone on top, to sink back. And then that causes this shin bone to compensate for those differences, and that will start to rotate out. And that's how you get that rotation of that tibia bone. Also, what's going on is you have your three arches here, your three natural arches. You have the one down the outside here, one down the inside, and then one straight across. Those arches can start to collapse, and that's what I see a lot when I do these foot scans with people. It's like when those arches collapse, your foot collapses, and then you get a very flat foot when it shouldn't be so flat. And the same can hold true if you have too much of an arch. You're not going to have that support there either. So what I do specifically in that special and sets me apart is I can work on this foot. I can adjust every single bone in this foot. There's 26 bones in the foot. And then I can work on the ankle to help with that counter rotation, which once again is going to affect you all the way up. So the first exercise I recommend doing is to help strengthen and stabilize the foot intrinsic muscles. So what I mean by that are there are muscles that come from the foot up into the leg, but there are muscles that stay just in the foot and ankle and don't come up past this area. So these are intrinsic muscles. They stay within this area and they don't leave the area at all. So most people, these muscles are pretty weak and they're not working the way they should. So what we need to do is we need to start strengthening those. So this is the first exercise I recommend. It's very simple. You can be barefoot or wear socks like I am. Get a towel, something laying around the house, and what you're going to do, you put it underneath your foot, and I want you to use your toes to curl that towel closer, push it away, curl the towel closer, push it away. Very simple exercise, but very effective at working those foot intrinsic muscles. You should feel it right at the bottom of your foot is where you should start feeling like you're almost working out like you're doing bicep curls, except you're doing it with your feet instead. For the next exercise, we're going to work on those intrinsic foot muscles again, but this is going to be a little harder because you have to do some stabilization and balance while you're doing it. So what you'll do is you'll do one leg at a time. Focus on the leg that isn't moving. So we'll say it's my left leg right now. This leg is in the ground. What I want you to do is I want you to think of your foot like this. You should have this point on the inside up towards the big toe, this point on the outside up towards the pinky toe, and then your heel back here should all be implanted in the ground at the same time. At no point should any of those points come up off the ground. So that's what I want you to focus on. I want you to focus on these 3 points driving into the ground and staying in the ground, okay? This other leg is then moving. While this leg is moving, focus on those 3 points, focus on pushing them into the ground. What you do is you'll come forward, tap, come all the way straight back, tap, forward, tap, all the way straight forward, tap. So like I said, this is going to take some balance, this takes some getting used to, but instead of focusing on what this leg's doing, I don't really care what this leg's doing, and after you realize, hey, I'm just going forward and back, you don't really need to focus on that movement. Focus instead on driving those points into the ground on the foot that's not moving, okay? You should start to notice it's getting hard down here by my calf. It's also getting really hard on the bottom of my foot. I'm working these muscles to stabilize my foot as I'm moving. Once this gets easier, you do about 10 reps. What you want to do is go straight side to side, like this. Same thing. Once the movement becomes easy and second nature, I just want you to focus on driving those points into the ground on the foot. Then if this is really easy, you can make it really hard, and you'll reach 45 degrees across, 45 degrees back. You can see this is even hard for me. But the whole important part of this whole exercise is make sure that foot is driving into the ground in those 3 areas. Your balance comes secondary, okay? Make sure you're working that foot. Me off of doing just a couple of those reps, I can tell you right now I'm pretty sore. So this is a very good, effective exercise at working those intrinsic foot muscles. So another big reason why the feet, ankles may not be supporting you from the ground up here is immovability, and it's also weakness. So I showed you some exercises to work on the weakness. Now I want to show you some things to help loosen up that joint, okay? Very simple exercise. All you need is a wall. Lean against the wall, put 1 foot forward closer to the wall, and all you're going to do is lean, bring that knee in towards where the wall meets the floor. And this is a good stretch you'll feel in the calf, but it's also going to help open up this joint back here in your ankle, because that ankle can be very stiff. And you remember when I explained that if the ankle's stiff, it's going to cause rotation and counter rotation all the way up, which is going to strain them back. So we need to loosen up that ankle joint as much as possible, and this is a good exercise to start doing it. Also, what you can do in complete simplicity, spell out the alphabet with your foot. That's going to help loosen things up to get the full range of motion in that joint. Finally, the last thing I recommend doing is rolling out and loosening up the tight muscles. So we worked on stabilizing, we worked on strengthening, and we worked on improving flexibility. Sometimes the muscles are just so tight, they're in such a spasm that you need to loosen them up before you can even get the flexibility in the area. Oftentimes people complain of tightness back here in the calf. Also, there's a tricky muscle, so you feel this long ridge right here of bone, your shin bone, okay? Just off to the side here, there's a muscle here called the tibialis anterior that can get really tight and painful and tender to the touch on people, especially if you're an athlete and you're running a lot. So what I recommend is get a tennis ball or something similar to a tennis ball if you have a lacrosse ball. I do not have one of those here, so I'm using this big ball instead, which makes it easier because you can see what I'm doing. But I recommend using something smaller and more finer. You don't have to use a big ball like this. What you do, you put it down, get up on your hands and your other leg so that all your weight is resting on that ball, and then you're just going to roll back and forth over the muscles. So what you're looking for is you're looking for an area that feels a little tender or tight, and I just want you to roll that out. You can do little circles around the area. You can do all the way towards the knee, all the way towards the ankle. But you want to make sure you're encompassing a big part of that muscle, and you want to make sure that when you find a tendon area, you're working circles around that tender area, okay? Then for the front one, same kind of thing. Come over on all fours. I'm going to do this leg so you can see it better. Find that area just to the outside of the bony ridge or your shin, okay? And then I want you to, once again, put all your weight on the ball, roll it out, find the area that's tender, do some circles around it, do some long lengthwise, you can do horizontal as well. Just really rub out and work that muscle. What we're trying to do is we're trying to get that muscle spasm to reduce. It's all very similar to a massage. We're also trying to bring down that inflammation.